10 silent colon cancer symptoms you should never ignore. Colon cancer is one of the most common and deadly cancers worldwide. Yet, its symptoms can be so silent that many people overlook them until it's too late. In today's video, we'll uncover 10 silent symptoms of colon cancer you should never ignore. Some may seem harmless, but they could be warning signs your body is trying to tell you something. Let's dive in and protect our health before it's too late. And make sure to watch until the very end, because even the last symptom might be the one that saves your life or someone you love. 1. Unexplained weight loss. Losing weight without changing your diet or activity level can be a red flag. This isn't the kind of weight loss people aim for. It's sudden, noticeable, and unexplained. Colon cancer can interfere with digestion, reducing the absorption of nutrients your body needs to maintain weight. Additionally, the presence of a tumor can cause the body to produce inflammatory proteins called cytokines, which speed up metabolism and burn more calories. If you've lost more than 10 pounds in a few months without trying, especially if you're eating normally, this could be a warning sign. Don't assume it's just stress or aging. Check with a healthcare provider. 2. Persistent abdominal discomfort. We all get stomach aches from time to time, but when discomfort becomes consistent or recurrent, it's a red flag. Cramping, bloating, or sharp abdominal pain that doesn't go away could signal inflammation or a growing tumor in the colon. This pain often mimics gas or indigestion, making it easy to dismiss. But unlike typical bloating, the pain from colon cancer doesn't go away with dietary changes or time. In some cases, it may even get worse after meals. If you've had unexplained abdominal discomfort for more than a week, it's worth getting evaluated. 3. Changes in bowel habits. Bowel habits vary from person to person, but consistency is key. If your routine suddenly changes, like going from daily bowel movements to skipping days, or switching between constipation and diarrhea, could indicate a problem. Tumors in the colon can partially block the passage of stool, causing alternating symptoms. You may also notice changes in the frequency, urgency, or sensation of not fully emptying. These changes may be subtle at first, but they usually persist or gradually worsen over time. Track your symptoms and talk to your doctor if they last more than a few days. 4. Blood in the stool. Seeing blood in your stool is always concerning, and for good reason. Bright red blood may indicate bleeding from the lower part of the colon or rectum, while dark tarry stools can signal bleeding higher up in the colon. Colon cancer often causes small, slow bleeds that go unnoticed until they show up in the stool. In some cases, the bleeding is so slow that it only appears as iron deficiency in a blood test. Even if you see just a few drops of blood occasionally, don't assume it's hemorrhoids. Persistent or recurrent bleeding should be evaluated with a colonoscopy. 5. Fatigue and weakness. Feeling tired after a long day is normal, but constant fatigue that doesn't go away, even after rest, could be a sign of something deeper. Colon cancer can cause chronic blood loss, leading to anemia condition, where your blood has fewer red blood cells to carry oxygen. Less oxygen means your muscles and brain receive less energy, making you feel weak and exhausted. You might also feel dizzy, lightheaded, or notice shortness of breath during mild activities. If you're sleeping well but still feeling drained, ask your doctor to check your hemoglobin levels. 6. A feeling that your bowel doesn't empty. Do you ever feel like you still need to go, even after using the bathroom? This sensation, known as incomplete evacuation, is often ignored, but it could indicate a tumor pressing against the colon wall. As the tumor grows, it can cause partial blockage, making you feel like your bowel isn't completely emptied. This feeling may be accompanied by straining or going to the bathroom more frequently. It's not just uncomfortable, it could be a warning sign of a deeper issue. If this feeling continues for more than a few days, talk to your doctor. 7. Penciled-in stools. A noticeable change in the shape of your stool list, especially if it becomes narrow or ribbon-like, could signal a narrowing of the colon passage. This narrowing may be caused by a tumor growing along the walls of the colon, leaving less room for stool to pass. Occasional narrow stools may not mean much, but if this becomes your new normal, it's worth investigating. This symptom often appears alongside constipation, straining, or a feeling of incomplete evacuation. Take a photo or note what you see. These observations can be useful for your doctor during diagnosis. 8. Constant urge to have a bowel movement. If you frequently feel the urgent need to poop but produce little or nothing, you might be experiencing tenesmus. This false urge is caused by inflammation or obstruction in the colon, often due to a tumor irritating the intestinal wall. It can feel like pressure or fullness in the rectum, even when your bowel is empty. Tenesmus may come and go, or persist throughout the day, causing discomfort and anxiety. If this happens more than a few times a week, especially with other symptoms, seek medical advice. 9. Unexplained iron deficiency. Iron deficiency anemia is one of the most common blood abnormalities found in patients with undiagnosed colon cancer. The slow chronic bleeding from a tumor can go unnoticed until it shows up in a routine blood test. If you're feeling tired, cold, irritable, or have pale skin and shortness of breath, you might be low on iron. This can happen even if you eat an iron-rich diet. If your doctor can't explain your iron deficiency through diet or menstruation, it's time to screen for internal bleeding. 10. Nausea or vomiting. When a tumor blocks the colon, waste can't move through the digestive system properly. This blockage can cause a backup that leads to nausea, vomiting, and abdominal swelling or pain. You may also experience loss of appetite, bloating, or feel full quickly after eating. These symptoms tend to appear in the later stages of colon cancer, but when they do, they often escalate quickly. Sudden vomiting, especially with abdominal pain or constipation, should be treated as an emergency. Don't delay, seek medical attention immediately. Colon cancer is often silent, but it doesn't have to be deadly. By paying attention to these subtle signs, you can catch it early and improve your chances of recovery. If you experience any of these symptoms, don't panic, but do talk to your doctor. Early detection saves lives. Please remember that this video is for informational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified health provider with any questions you may have regarding a medical condition. Thank you for watching. Stay informed, stay healthy, and don't forget to like, share, and subscribe for more life-saving health tips. See you in the next video.